So, when we think of healthcare, obviously we think of doctors and nurses. We've all seen TV. But there's actually dozens and dozens of careers that make sure people in Idaho are healthy and taken care of. Today, we're gonna go meet some of those unsung heroes. This is actually comfier than I expected it. I am so afraid I'm gonna break something. Although I guess technically this is a place to break something.
Yeah, we're gonna hinge at the hips.
I'm gonna get better at this. I'm gonna do this every day. St. Luke's is one of the biggest and busiest employers in all of Idaho. So it only made sense for us to start at their main hospital right here in Boise. First person I chatted with was Blair. She's a certified surgical technologist. They're the ones that manage all the surgical instruments and just make sure that the operating room is prepped and running smoothly. But if they're gonna let me into an operating room, I couldn't be dressed like this.
I mean, they said you'd never do anything with a theater major degree, but here I am, pretending to be a doctor.
I am learning how to wash my hands like I'm going in for surgery. Okay. Oh man, I have such a big head. These are always hard.
So these are our scrub brushes. That's soft and has bristles on one side.
Okay.
And then a nail pick also. So we're gonna start with the nail pick.
All right.
And sometimes,
Oh, whoops.
oh no!
Okay, I may need to start all over.
And we always start with the dirtiest part of our body to the cleanest part of our body. That's why we start with fingernails.
Okay.
Okay, now we're gonna go to our hands.
Okay.
Circular motions work best. Yeah, back side of our hand.
Like, how did you find yourself here in the first place?
Because this is actually my second career.
Really?
My first career was in veterinary medicine.
Oh, okay.
I was a surgical vet tech. So then I was like, well, how can I do surgery in a different capacity? So I was like, well, humans. I've done all the other animals. Why not? Why not
one
humans?
left.
Yeah. So I do it in 2 quadrants. So I do this.
So did you have to go back to school when
I
you?
did. So to become a certified surgical technologist is a 1-year program once you have the prerequisites done.
Let's cut someone open.
So this is my sterile gown and gloves. This is how I become a sterile person.
So what I'm wearing right now is not enough.
You
We
are
would have
not a sterile person.
I've been told that a lot.
So we put on our gown in a way that we keep this sterile.
Okay, and then now you're all set up
I'm
already?
a sterile person now.
Now you can touch whatever you want.
Yes. So this is a pretty standard operating room.
Okay.
So we have our OR bed. This is where the patient lays. Most people don't remember that they go into their operating room awake. So that's the thing about my role is I play a vital role in the surgery process, but most people don't remember they met me. I get a lot of satisfaction out of my job knowing that this person is in the most vulnerable state they can be. They're not awake. They cannot advocate for themselves at all. We become those advocates. So having a team of people in an OR that can see things from different angles and different perspectives really aids in that ability to keep them safe.
We are following Jason, who works in healthcare facilities management. He is the man that makes sure that nothing gets broken here.
I fix anything that needs fixed. It can vary from light bulbs to toilets and everything in between.
How do you know how to do all of the things that make this place run?
There's a lot of on-the-job training. Now, given you need to come into it with a basic set of skills, maybe some basics on electrical or some basics on plumbing, but past that, everything else will get taught to you on the job.
Cool. Well, can you take us into a room?
Absolutely, let's go
do
take
it.
a look.
As Jason told us all of the things in the hospital that he's responsible for, it became a long list.
The first thing I'm gonna look at is ceilings. Do we have damaged ceiling tiles? Walls and paint. Are the windows leaking? Check our gas ports. Emergency generator, fire system, smoke alarms, sprinkler heads, the pump that runs those sprinkler heads. We're gonna have to look at all of that.
Okay, this is a little different than the one I have at home.
Correct, these toilets are gonna be a little different. They are tankless. So your minimum requirements are gonna be as simple as a high school equivalency. Past that, we are really looking for individuals that can critically think, that maybe have some basic hand tool experience, and just have that curious mind that they constantly want to learn new things. Patient and visitor safety is always our #1 concern. It can be very easy to take for granted the fact that you walk in the building, you walk into work in the morning, and it's a comfortable temperature, and the lights are on, and the toilet's flush, and everything's working. We are the department that is able to make sure that happens.
So we're gonna go right in here to this room.
Okay.
My name is Julie Snyder, and I am the System Director for Respiratory Therapy.
Is breathing important to health?
Breathing is super important to health.
Okay, so if we stop breathing, that's not gonna
You
work.
stop breathing, that's not good, and that would be us. That's what we do. We keep you breathing. Respiratory is very exciting. We always like to say womb to tomb. So we work from delivery rooms all the way up to patients who are elderly. We work in rehabs. We help people quit smoking. We work with chronic disease, cystic fibrosis. We help kids with asthma see how they can actually be normal kids and go run and play and have fun and work. They don't need to be, constricted by their disease.
Do they have names?
They don't.
They don't? Okay.
For anything we're doing, like somebody, stops breathing, we run into the room, this is our spot right here at the head of the bed. Our process is to put this in first. It's called a laryngeal mask airway, and basically it has a balloon that pumps this up, and what this does is it sits in the esophagus. But then there's an opening right here that allows air to go into your lungs. So this is a resuscitation bag, and so we hook it up right here,
Whoa!
and we can see the lungs pop up.
Look at these lungs.
And this one's the stomach, so this is the
Oh,
stomach
oh,
too. So
okay.
that's
I was
why it
like,
doesn't-
and he has 3 lungs.
No.
Oh, okay. In and out.
And then this guy down here,
He seems a lot more relaxed than the other
he's
guy.
a lot more relaxed. So this is a tracheostomy.
Okay.
And this is actually a tube that goes into the airway so that the patient can breathe. You get some goop and stuff in there, and so we change these out every day.
I imagine goop is a regular part of many
It is.
people's jobs here.
So what we're gonna do is we're gonna place the dressing, and it's gonna come up underneath.
Okay.
So you're gonna pull those tabs up underneath that plastic trach collar.
He looks so fancy.
The lungs affect the body, and the body affects the lungs. So you really have to have a well-rounded education about all the body systems and everything that happens. And it's very rewarding. I mean, helping people is kind of the reason why you get into this, right? Because you want to help people. And I would say respiratory therapy is really neat because you can see that help. You can see that progression.
So, as you're noticing all of this medical equipment, someone has to build and maintain all of that. Next, we moved on to one of the coolest parts of the hospital. Where are we right now?
We're in the HTM shop,
Okay.
Healthcare Technology Management. I fix anything from thermometers and IV pumps to anesthesia machines and defibrillators.
Okay. Is this your shop here?
It is.
Okay.
Come on in.
Show me around.
We got a bunch of stuff from broken tables to IV pumps, our simulators and tools and everything we need to do our daily job.
How did you get here?
I was always playing with something growing up, building things, playing with tools, and the medical field was always in the back of my mind, but I knew I didn't want to do patient care things. And after some research, I found that this was a career, and I've been doing it for 12 years, and I absolutely love it. I got an associate's in applied science for biomedical electronics, but you can get the biomed experience in the military, and we can just on-the-job train you. That is a surgical table.
Oh, this is where the bed goes. Yep. I laid down on one of these earlier.
Yeah.
I didn't realize it was so technical.
Yeah. So up here we got some gases that is needed for testing a lot of equipment.
Okay. You just have gas flowing through the building and just whatever you need gas.
Yep.
Okay, cool.
That's
Makes
right.
sense.
We got IV pumps. As you can see, we get a lot of these broken.
What is this big guy?
This is an anesthesia machine that the anesthesiologists use for when you are going under in surgery. I have gone into live cases.
So you've actually been there while they're operating and you are working on the fly
Yep,
to make sure this is staying fixed.
that's right.
Is this your office?
This is my desk. We got a pressure gauge. This is my IV pump set up with my IV. You don't see my face very often. The patients don't. But I love that I'm able to help a community, help people get better, and save people's lives behind the scene.
Well, we are here at the St. Luke's Plaza to learn about a whole different side of the healthcare industry. And I am so excited to go inside because I did not plan for this weather today. Turns out some of the most important healthcare decisions are actually made in the IT department, or what St. Luke's calls information health technology.
You're a natural.
I
I work with a team of incredible technologists, and our job is to make all of the applications, the systems, the machines work when they need to, how they need to, why they need to. So it could be someone who works as a program writer, a software developer. It could be someone who works on the actual hardware of a machine itself. But it's someone who likes to think mechanically, logically. They like to do puzzles. They like to troubleshoot things that aren't working and figure out why.
So where are we right now?
We are in what we call our Emerging Technologies Innovation Lab.
Yeah, so the Emerging Technologies Lab, we developed it to test new technology and look at how we could bring in innovations that really elevate the experience of not only our patients, but also our workforce.
So this is your mock-up.
Yeah, this is where the testing occurs.
This is
for
your
us.
IKEA showroom of a
Yeah.
patient's home.
We're bringing in our bedside team members and workforce to get their hands on and provide their feedback. This is a directional speaker that the patient could control.
Oh, I literally just thought this was like a fancy light.
No, we're also looking at digital whiteboards. So the normal whiteboard that's in the patient's room,
Yes.
that can potentially be something that's interactive. And so as the patient, I can have a conversation with you as your nurse and document, and you can see what I'm documenting. The thing that could take hours to get to is so simple, and we make it easy to do the right thing. This space in the corner is really showing a virtual care workstation. It's basically like a virtual hospital. This is going through the ability to even do things like vital signs on a patient. And it can, by zooming in closely to, it sounds very Star Trek-y,
Yes,
but
that
by
does.
zooming in, you can pull a full set of vitals. And so that's where the future
I like want to go in the other room and just be like, diagnose me.
But that's where the future of care is going. And so it's important for us as we're looking at this in the lab to think through, like, how is this impacting and how might we think differently because of technology that's available.
So we're not right directly at the bedside, but we appreciate how the work we do directly translates to the bedside. And so a mouse click, a press on the keyboard, as minor as that action may seem, it can translate to a good or a bad experience for that patient receiving care or treatment. And we take that very seriously. And so when I go home, I feel proud about the work we do and the benefit that that provides to our community. So in 1902 we opened. St. Luke's Information Services was officially established in 1992. There's a stereotype that still exists, that if you're a technologist, a computer programmer, you're a guy, you drink Mountain Dew, you're a gamer, and that's kind of a worn out trope. Like, this is a profession and a career that's open to anybody, male, female, gamer, non-gamer. If you like to solve problems, if you're naturally curious, if you like to tinker and build things, this is a field that has unlimited possibilities for what you might be able to do.
My background, I started as a nurse, right? I was on the bedside, and after a while I got burnt out. Lots of people are actually looking away from the bedside because they're realizing, okay, working nights isn't good for my body. It's not good for my mental health, and they're looking for roles that really provide that stability. There are so many different career paths for nurses or clinicians that most of them aren't even known, but honestly, if you're a care provider, you can trail your own pathway if you want.
What I love about healthcare is the grip it has on our employees. People choose to stay here because the why of what you do is more important than the what you do. And healthcare offers the best why that I've ever experienced.
My name is Erin Barker, and I am a program manager for the Employee Wellbeing team.
What is that?
That's a great question. So we technically work on the HR team, so for people support, coaching, movement, meditation, vision setting, honestly, just helping people feel better at work. I run our midday move programs, so allowing a few minutes of movement during the day for our team members to join virtually or sometimes live in the office. We do anything from stretching to squats to dance routines. It's kind of just a hodgepodge of let's make this fun and let people connect through the ether and also move our bodies in a way that feels good.
Is it something you think I can do?
I definitely think you can do it.
Okay.
So we are in an office space.
Okay, is this where you usually do this?
Well, you know, we do it on the go, so we do it wherever we are, because you can move anywhere at work.
Okay, all right.
So today we're gonna do it here.
Okay.
Feels good. Back through that center and thinking over to the other side, nice and easy. Doesn't that feel so good?
That feels good.
Okay, opening up those hands, nice big chest opening, nice big deep yogi stretch. It's the best job in the whole world to help our team members feel their best at work, because we ultimately know that when our community members come in, they're getting the best care and the best service because you are showing up your best. Big shoulder rolls. So kind of settling in. Oftentimes in healthcare, these are people who are natural givers, right? They have this compassion to want to help people. And sometimes the work is hard. People lose some of that connection to why they got into this in the first place, right? The burnout that exists. They lose that interest and that joy in doing what they do. That's a gift to give somebody, that reconnecting back to why they got into working in healthcare in the first place.
Healthcare is not just doctors and nurses. Whether you're interested in direct patient care or not, there are so many amazing opportunities. And not just at St. Luke's, at healthcare facilities all across Idaho, where anybody can find a fulfilling career helping to save lives.